Hello, Dr. Naveed. I'm Howard. That's Fred. Phil, Zoom Josh over there. He's not paying attention. How are you?
Good morning. Good.
Hello, Doctor.
How are you guys?
We're great. And you know what? Your microphone sounds pretty good.
Awesome.
And that's
what I wanted to hear. That's what you're always worried about when you kind of log into these things, right? First thing in the morning.
No, 100%. And especially it's when we have a guest like you come on in the middle of the show versus during a break where we can test it. But no, it sounds great. And welcome to our program. We're thrilled to have MD Connected associated with the show. I read an email just a couple minutes ago from a listener who had heard about it, was young, and didn't know they could do it. But let's just get started. You're the Chief Medical Officer. What exactly do you do at MD Connected?
Yeah, so no, it's been very exciting times, and I guess to be a chief medical officer during a pandemic, it's been interesting to say the least. But essentially, I help to oversee our physicians that are part of MD Connected, the different services that we provide, trying to grow us into different markets, and basically just making sure everything's running smoothly, going well, that we're keeping our patients happy, that we're completing things in a way that's, of course, legal, ethical, as
Obviously.
everybody does. Yeah, the safety of our physicians and patients.
Dr. Naveed, let's be clear. MD Connected is about connecting patients like our listener with physicians that can walk them through the medical cannabis process. And I know you guys are associated with I just want to make sure I get it right. It's called Medical Cannabis by Shoppers, and we'll get to that in a second. But by now, everyone knows it's legal, but for 16 or 17 years, it's been legal for prescriptive reasons. What typically are the things that people are looking for when it comes to a medical cannabis prescription?
Yeah. So, I mean, for the most part, in terms of the medical conditions that medical cannabis can be helpful to treat, there are so many. The list is extensive. I'd say the most common conditions would be chronic pain, and this could be due to multiple surgeries that have occurred, accidents that have happened, arthritis, debilitating arthritis. It's amazing how by providing medicinal cannabis, we're able to get several medications off of otherwise very addictive medications or ones with high side effect profiles. So, the people who come in, they could have various medical conditions, but essentially the treatment is the same. And we do try to take a very collaborative approach by having nurses, educators, cannabis educators as well as physicians who work together in order to treat the patient as a whole, so that way we are providing an appropriate dose, we have appropriate follow-up, and we also have specialists on board. So, essentially we're also able to find out what the underlying cause may be, so there's management of pain, maybe anxiety, maybe issues with your digestion, but also trying to address the root cause.
And by having such a professional presentation, people that might be a little apprehensive going that route obviously feel a lot better when they're handled in that manner.
Yes, I feel like the vast majority of people, I mean, you may hear about it while you're on a call with them, but definitely at least afterwards with the comments that we receive that, it's essentially changed their lives. I was really happy to hear about the person who reached out to us last week and, you shared sort of their story with us too. And again, it doesn't matter the age, it doesn't matter the issues. We don't pick the challenges we experience in life. And so, to see it actually truly help people has been amazing, really, to say the least.
And all the sort of giggling about weed and getting high, it's kind of, to me, that conversation has gone to the background because you can use it recreationally, but there's a big difference when you're using it medically, because someone is going to say, listen, here's like for instance, sleep disorder is one that comes up a lot. And there's a bit of a debate about, I was speaking to a friend of mine who's got a PhD recently, and he was saying, they found out that THC isn't good for sleep. And I'm like, I don't think that's true. But the point is, if it is going to work for somebody, someone like you or somebody at MD Connected will help find the strain, the dosing, and give you information that will lead to some solutions.
Exactly. I mean, you're right on with the discussion about THC and the different strains that are available. It is used recreationally, but essentially we're not prescribing this in order to get people high, right? That's the goal.
Mm-hmm.
You're not achieving or getting high off of these products. You're having management and control of your symptoms. So I agree with you. There's a negative stigma that unfortunately still surrounds medical cannabis. And I've found amongst especially the elderly and even amongst certain cultures, So I hope with MD Connected, we're hoping to change that just by educating people, and our patients that come through.
Howard, you mentioned your discussion with the PhD about THC. Now, is that true? It would work for some people and not other people, and that's where you drill down and find out which strain would be better for one person over another. Because, and listen, I've done it. Some people may share what they have, and it doesn't. It works for that one person, and they give it to somebody else, and it doesn't. So
Yep.
it leaves the wrong impression. Well, that stuff doesn't work.
Right. And what I also guide patients and people to, really truly understand that medicinal cannabis is different than anything you may have used recreationally. So where you may have thought, a certain percentage of THC being present would maybe resolve your symptoms or cause anxiety, when it is in the form of medicinal cannabis, it is managed a little bit differently.
Well, Dr. Naveed, if I may just interject, because I'm a recreational user, can you give me like the difference between what I might use, a strain I buy, from some dispensary versus what you might recommend to me as a patient?
There's just so many different brands, and I don't want to necessarily, mention one over the other, but really the vast majority of what I find has worked well are CBD oils, so we really go in the direction of that. And, we aim for a lower THC content when we are prescribing this. However, it's dosed differently depending on the condition that you may have, right? So, a nighttime dose versus a daytime dose, the percentage of THC may go up, but for the most part, I found that the oils have worked generally well for most people who've come through.
Well, it's interesting because I would love to have a consultation for sleep because, I've tried a bunch of different things on my own. Believe me, I'm experimenting every day, doctor. And, but I would like to know, because I think that's and there's things like, as you say, for inflammation, for pain management, for sleep disorders. There's so many things. And even if, that's why I'm saying for an experienced user like me, maybe it would be, an interesting conversation to have with someone like you or one of the doctors at MD Connected, because then you might say, maybe dial back the THC at bedtime and kick up the CBD content, and maybe that would help me sleep all the way through the night.
Absolutely. And, that's where the combination of, one of our physicians, including myself, and one of our cannabis educators is so helpful, by being able to sort of combine and collaborate our experiences and kind of go over your medical conditions. I feel like that usually helps us best decide exactly the question that you were sort of asking, or the advice that you've been looking for.
All right.
Yeah.
And that's the bottom line, where obviously it's an individual thing. You've got to find out what's right for you, just like any prescription, I guess.
Part of what makes sets MD Connected apart is the commitment to education, as you can hear from Dr. Naveed, even someone that thinks they know it all, like me. I think I'm a medical cannabis doctor. It's worth a conversation. The website I want to direct everyone to is mdconnected.ca. And to be clear, I want to make sure you understand what it's all about is talking to somebody to get a consultation, to get the right prescription for the cannabis that will help you with your condition. And it's really easy to set up. People just go to the website. How do they do it?
Yeah, so basically there are different ways that you can go about this. One is, just as you mentioned, www.mdconnected.ca, or if you prefer to speak to one of our care coordinators on the phone, you can call 1-877-406-9362. But essentially, if you decided to go through the website, you select book a virtual visit. select specialist consult, at which point you'll just be prompted to enter some basic information like your phone number, name, etc. And then you would select cannabis consultation. You can pick a date range, a time that you prefer as well, just to make sure this is as accommodating as a process for you. And then you would have your appointment time and date confirmed.
And as I mentioned, MD Connected is connected and partnered with medical cannabis by shoppers to ensure the patients have access to a variety of cannabis options. Thank you so much, Dr. Naveed. I hope this was okay. I hope we get a chance to talk to you again.
Honestly, this was fun. I really appreciate, sharing this information and speaking with you guys. So thank you for having me.
We can be fun. We're fun people.
No, it's been great.
We got a bunch of people on this call. You're like, who's that guy? Who's this guy? There's Humble and Fred. Look at us. You seem like a nice person. We're friendly.
I agree. That's great.
And I hope, mdconnected.ca. Thank you, Dr. Naveed. We will speak to you soon.
Take care. Bye-bye.
All right. There you go. Yeah, man.